Good day, members of the Chamber family. We are privileged today to be joined by Scott Barlow with Revere Health for our Chamber chat today. Scott, we're lucky to have you with us today. To start with sharing perhaps a little bit about your experience in the Valley. How long have you been here? How long have you been doing business? Maybe start from when you were educated and bring us up to where we are now in a bit of a brief overview.
Well, thank you. It's a pleasure to be here, and so value the Chamber and the many years that we've been a part of the Chamber and so many different elements of our business journey. So I'm originally from Bountiful, so kind of a foreigner to Utah County, if you will, although I've been in Utah County now for 27 years. So in terms of where we've lived, it's been here. But Revere Health is an organization which used to be known as Central Utah Clinics, been here for 52 years this July. So we're a relatively old organization in terms of business in this valley, and have seen an evolution as time's gone on. So I've been with Revere Health now for 21 years. I've seen it, when I started, we had 100 employees in 6 sites, and now we have over 2,000 employees and over 114 sites of business. Almost all are in Utah, with the predominance of that being in Utah County. So for us, the entire county is our field. We serve and live in these communities, and are grateful for the breadth and spread of the Chamber to make sure the things we're doing are touching all the people in these various parts of this great county.
Do you see your rural business demands increasing? Is it just due to expansion, or is that really kind of your lane for Revere Health?
It's a combination of things. So rural areas are they variable. Our service and price has been the same for 10 plus years, and the population hasn't grown much at all. When you look at our service in Kanab, it's grown. We've more than doubled in size in Kanab in the last 5 years. And so again, quite variable in terms of what area you're talking about. But a lot of our growth has really come from other medical practices wanting to join our system. So about 53% of our growth since I've been here in 21 years has been what we call affiliations, established practices and businesses looking for a better model, and just feeling like that we could meet that niche for them, and the rest would be organic growth with the population that we're having the privilege to serve.
What do you think are some of the challenges and perhaps one or two opportunities that growth so concentrated here in Utah County will bring?
Well, I think the biggest challenge that we're facing is just the labor pool. We have a great economy in Utah, and Utah County particularly, and so just the labor pool. We use semi-skilled or highly skilled labor in our industry, of course, and we just simply can't find the growth. We've had some great partnerships we've forged with our local universities, Utah Valley University, MTech. We have a placement program. We started with them now for some of their medical assistant training programs to help there. But the labor pool is probably our biggest challenge that we face. Transportation was for a while, but that seems to be mitigated a little bit. But now for us, labor pool is our biggest challenge, is finding people that can fulfill the obligations of taking care of people's lives.
What do you think, what are some of the values and principles that have remained a part of the Utah Valley character, even though you've seen a lot in the last 2+ decades?
I think what we've really appreciated, and I have the opportunity to speak a lot across the country on some of the care innovations we've done the last 10 years. What I've really appreciated about this valley and this state, but this valley particularly, how collaborative it is. People truly try to work together to find solutions, even competitors, different industry, and I don't hear that from my colleagues across the country. So there really is, I think, an organic value of just trying to help and make a difference, and leaving a legacy beyond your business success for the people of this area to enjoy and appreciate, which again has become part of the magnet of why more are coming. Remember Natalie Gochner in one of the executive summits said one time, the only way to keep people from coming is make it a place no one wants to live in. People want to live here for reasons, and those values have remained, I think, intact despite the growth, and just a chance for broad talent and people to come together and take on difficult situations like housing and transportation, and find solutions that are sustainable and workable and lift the lives of everyone.
You've got some years under your belt, but you've got some good years left. What's left undone, Scott, for you? What do you have yet to accomplish?
Well, for us and for me professionally, my healthcare career started in the nonprofit sector, where we were very mission-driven up in Salt Lake, and ran clinics for homeless people and low-income and uninsured people. and enjoyed that part of my career, but also saw that the elements that business and enterprise sometimes drive of efficiency and improvement get lost in mission. And the opposite can be true in businesses where, again, the sense of business success sometimes can lose a sense of value in mission. So my hope is to try to continue to find a balance of both of those, where business can be good community stewards of really what they're trying to do, because I just believe that when you add value, you're going to find economic value as a byproduct of that. So for us particularly, we've been very, very involved in very aggressive efforts at the federal level, particularly in the state level, of finding ways to reduce the cost of health care. It's now known as value-based care across our industry. We were doing it 10 years before it became an industry buzzword, and have found some pretty tremendous success where we're literally lowering costs of healthcare, not just slowing down the growth, literally lowering the cost of healthcare in the programs that we're part of. So for us, we want to continue to see that journey go forward in some more aggressive ways, and truly get a handle on our specific industry, which is affordability. Businesses cannot afford the healthcare that we're getting today, and we're not getting out of healthcare what people should get out of it. So for me, I just have some determination that before I retire, whenever that happens, that I'm going to see those initiatives continue to grow to where it's truly felt by the community and seen by the community of something that's different than what we've had for the last 25 years of healthcare.
Well, you hit on the three major points of healthcare and providing value to the Valley: access, affordability, and price transparency. You know, they say pick two of the three. You can't have all three, but you seem to be doing a pretty good job at keeping a pulse on all three. As you look at the growth of the county and Revere Health's place in providing health care support to our residents and our families, what would you hope our families and those listening take away from responsible health care that they themselves can take the lead in terms of self-evaluation, self-care, self-observation, preservation? What can we do as citizens that would partner with Revere Health in maintaining a mental health, physical health level of quality of standard in our own lives?
Well, I think you hit on a key issue. The American health care system has really been built upon a rescue care model.
Yeah.
Do whatever you want to yourself and we'll fix you. Well, that presumes immortality. That's not part of this journey. The reality is people are the ones that determine their health. And the healthcare system is now trying to pivot to become an assistant to that journey versus the one that has culpability for that journey. So a lot of it really comes down to really identifying what do you want out of your health. We're all going to have separate journeys, and some of us are committed to exercise, some of us are not. Some of us are committed to medication management, some of us are not. What we've got to do a better job, and what hope patients would help us with, is come in and tell us what you're really committed to, and let us help you year by year by year have the best journey you can have, recognizing that it's going to be different. And so we've really tried to learn how to help people feel comfortable in that setting, how to have continuity of relationships, and I've learned that when you do that, people do in fact understand their health care options better, they do make better decisions, and they live a happier, healthier life. So for us, it's all about us becoming clear what you want and then making sure that we're delivering that to you, and if not, we want to know about that. And we really want to try to make sure that we're reinventing ourselves to be that ally versus that party that's responsible for helping you get out of situations that in a lot of cases are not mitigatable other than temporizing agents, and those don't become very good long-term, and frankly they're not very fun journeys for people as well. So it's that whole pivot now of people feeling empowered, articulating what they want out of their health, and making sure that you're finding the health systems that will deliver to you based on what you need and want, not what we think you should have.
Well, as you can tell, we have been really fortunate to spend a few minutes with a real authentic perspective and discussion with Scott Barlow. And he has been true to his word. The more I get to know Scott, the more I realize that he really is in this valley to see it succeed, to raise a family, to help others on their journey in raising healthy, vibrant families and communities here. We're so grateful, Scott, for your time. Thank you for being with us today.
Appreciate you in the chamber. Some fun things are happening, and great to be a part of it.
Well, you've helped us get this far, and we are leaning on you to help us for the next couple of decades.
Happy to try to contribute as best I can.
Thank you.
Thank you.
Awesome.